Hi guys, welcome to our another anatomy lecture. Today we're going to talk about anastomosis around the axillary artery. Right. So the axillary artery can undergo a lot of um, obstruction because of the movement of the upper limb against the exoskeleton. So this can lead to kinkling of this artery, the kinking of this artery. So because of this rapid movement, there are also other branches that will anastomose around the axillary artery, right? To give a reverse or an alternative route, right? So from this diagram, let's say that we have ligated the axillary artery at this level. So what is going to happen? So let's take a course and take a look at the subclavian artery. So the subclavian artery is actually also divided into three parts. The first part of the subclavian artery, it actually gives what we call the internal thoracic artery that we're going to talk about in thorax anatomy. But in terms of the axillary artery anastomosis, we are concerned with the second part. So the second part of the subclavian artery is going to give the costal cervical artery or the thyrocervical artery or the thyrocervical trunk. So this thyrocervical trunk is actually going to give what you call a dorsal. It's going to give your cervical dorsal trunk, which will give a superficial cervical artery and a dorsal scapular artery. So the dorsal scapular artery will actually run along the medial border of your scapula. All right, you can actually see. So blood is going to be reversed because we have ligated this position. So blood is going to be reversed, and we are now going to have blood moving along this dorsal scapular artery, bypassing this route. You understand? So from this, the dorsal scapular artery is going to anastomose, right, with the thyrodorsal artery, which is a branch of the circumflex scapular artery. And then from the circumflex scapular artery, it is going to drain into the subscapular artery. And we understand that the subscapular artery, it's a branch of the third part of the axillary artery. And then it drains into the third part of the axillary artery and continues into your brachial artery. So let's take a look at another diagram right here. Right, this part is a third part of your axillary artery. It's going to give your subscapular artery. And remember, we said the subscapular artery is going to give your circumflex scapular artery. And it is your circumflex scapular artery which will run along the lateral border and anastomose with the dorsal scapular artery coming from your thyrocervical artery. So this anastomosis will give an alternative route if there is ligation of your axillary artery. Take note, this anastomosis can actually be very important when it comes to atherosclerosis of your axillary artery or obstruction of your axillary artery. So this is the anastomosis around your axillary artery. Thank you so much. Take care.